BDNF and pain linked. So why does this make complete sense? And I'm talking from a physiological level, but probably also many other levels as well. So brain-derived neurotrophic factor gets secreted, and the secretion of BDNF increases the response of the nociceptors. These are pain receptors that basically sense when a part of the body has been compromised. This, my friends, is absolutely brilliant on the part of the body, on the part of the healing, healing force in the body. It makes complete sense. Because if you have a compromised nerve, it's been smushed, clipped, its integrity has been compromised, then what do you need at that site of injury? You absolutely need BDNF that will stimulate the growth, the rebirth, neurogenesis of the neuron. And so it's interesting, and this is in the research, that BDNF is linked to pain to the nociceptors. And so you have BDNF potentiating, causing those nociceptors to lower their threshold. Remember, pain is dynamic. It is not a static entity where you have, a neuron that's fired and then you have pain. It's fluid. And so you have some people in identical circumstances experiencing different levels of pain. Some people have higher pain thresholds. Some people have less severe pain with the same stimulus. And all of this is related even in the same person. So the example I used in an earlier video was you burn yourself cooking on your left hand. It's not a huge burn. You later are taking a warm bath and your right hand senses the temperature of the water as perfectly fine. Your left hand that has been burned and is in the healing process actually lowers the threshold, whereby the nociceptors or the thermoreceptors get triggered, so you feel pain in the same water, and the temperature is presumably the same. That's an example of that threshold for pain being lowered in order to initiate and protect the healing process itself. If you're going to be undergoing cellular repair, if you're going to, fix the neuron, then you need a greater buffer. You need more insulation. You need a better boundary. And that is what pain being triggered more readily affords you. It affords you protection in the healing context. So that's really interesting to me. BDNF looks, according to the stuff I came across, in this kind of scenario, gets secreted by the microglia. Microglia are immune cells that are specific to the nervous system. And so they are macrophages that move around and chew up detritus, phagocytosis, we call it. But they also they're going to be some of the first responders. And so you want the first responders to be secreting BDNF to further heal at the injury site. And so, because the question, okay, you may not have made these these particular jumps. But the question I had was, before I figured out or found out that one of the ways BDNF gets secreted is through the microglia. Neurons are huge cells. I mean, you have a cell body, which is, the command central of the cell that's in the spinal cord, in the spinal column. Then you have a long axon that, depending on how tall you are, can span the length of your leg. And so to move something, BDNF is manufactured in the cell body, but then you're going to move it to the periphery. You do have what are called axonal transport mechanisms, but these can take days. And so that's not going to be a very effective way to get BDNF to the site of the injury. So it makes sense that the immune cells the microglia are part of how you get BDNF secreted at the site of the injury in response to pain and the stimulus of the nociceptors. That makes complete sense to me, and that's absolutely brilliant. But it also is likely one piece of the puzzle in terms of how crossover stuff happens, which is, I have a holistic philosophy, and I am curious about what these mechanisms are, whereby you end up with mental emotional stuff turning into physical illness, physical pathology coming out of, a history of mental emotional abuse, psychological abuse, nothing physical. Or vice versa. You've got physical stuff that can turn into mental emotional stuff. And it's likely one of the pieces in this puzzle is likely the immune system and potentially the microglia. I mean, it looks like this is also part of where chronic pain situations come from, because BDNF does potentiate some of the receptors, like I told you, lowers the threshold. And what happens is then those receptors are more likely to fire, and then you end up with hyperalgesia, right? That means increased sensing of pain in particular. Or I'm going to say it wrong, allodynia, where you've got receptors that don't typically exhibit or send pain. They're not nociceptors. They're regular old sensory primary afferent neurons that are sensing stuff, but they can get recruited basically to send pain signals. And this is part of the loop that occurs in chronic pain, neuropathic pain scenarios, would be that you get caught in this this loop of pain feedback being sent to the brain. The other piece to remember is this tends to happen when you're shutting down physiological mechanisms, which is not surprising to me. If you have the administration of the opioid class of drugs, say post-surgery, then oftentimes though the NMDA receptors will exhibit hyperalgesia after the drug wears off. So they're now more likely to demonstrate, to feel, to trigger in the presence of a pain signal. And that, again, from a naturopathic holistic context, that makes complete sense, because you've got this inflammation occurring, and then you've also got a pain signal that's trying to happen, but you're suppressing it, squelching it. And so the body goes, I mean, in its wisdom, is trying to get the signal, because pain is protective. Pain is going to prevent further harm. And if there's no pain signal getting through, then Houston, we have a problem, right? We've got to make sure the body knows that there's pain going on here, because otherwise we can cause more harm. So then the body lowering the threshold, the receptors having the threshold lowered to sense pain sooner, makes complete sense to me, because you've shut down that mechanism. The other thing, I mean, this is a perfect picture as to what happens on a mental, emotional, psychological level when we again suppress or try to massively avoid pain, emotional pain, and we don't want to deal with it. And then I've observed this over and over again in my office, that it starts trying to show up in other places. It starts trying to get our attention, because ultimately pain is part of the healing process. It is integral. It is related to BDNF, and is integral to BDNF, and is integral again to the immune system, right? Boundaries. This is our physical picture of boundaries. So I hope you find that interesting. I'll keep trying to bring you information about BDNF. Appreciate your support. If you find this useful, it's okay to subscribe. Thanks for tuning in. Adios.